When cancer happens, you don't put your life on hold. You fight it. In India, more than 4 million were reportedly diagnosed with cancer during 2018 to 2020. 2.3 million succumbed to the disease in that period. 1.9 to 2 million people were diagnosed with cancer in 2022. India's cancer burden is expected to rise to 29.8 million by 2025. Over the years, cancer cases have gone up exponentially and has consumed thousands of lives all over the world. In the last 2 centuries, science has made many landmark achievements in medicine. Since the first use of radiotherapy in cancer in the late 1800s, scientific progress has come a long way. These researches have given birth to technologies which look promising for cancer care.
In my 45 years experience as an oncologist, I can say one thing: it's a very complex disease, ever evolving, and it is an enigma. Cancer is nothing but interference in the death of a normal cell.
It is this enigmatic nature of the disease that inspired Dr. Ajay to work in the field of cancer research at MD Anderson. After which, he returned to India and started HCG, a health enterprise that aims to manage cancer through new technological strategies. Back in India, he began working towards upgrading tech interventions and tech-based approaches in cancer management. Dr. Ajay brought in leading oncologists and started a chain of 22 cancer centers with innovative diagnostics and cancer care. 2/3 of these centers are in Tier 2 and 3 towns and work on the principle of spoke and hub model. This spoke and hub model not only enables remote supervision of patients but also helps transfer the knowledge gained through research at its center of excellence at Bangalore and Ahmedabad to the spokes. In India, cobalt-based technology in cancer care has been used for decades. HCG brought in new technologies and introduced them to Tier 2 and 3 cities.
If proper technology is brought near your hometown and make it accessible, if you go and take a treatment and go and sleep in your own bed in the night, people will come, they will get the right treatment, and we can win the war on cancer by this.
Technologies like PET can often detect early signs of cancer, heart disease and brain conditions. It involves an injection of a safe radioactive tracer that helps detect diseased cells. When combined with CT, it can give a more detailed picture of the affected areas.
PET-CT is a new investigation tool for diagnosis of a cancer. Even the smallest of the lesions can be seen. It gives us a lot of information which other conventional imaging modalities such as CT scan and MR scans cannot give. We inject a radioactive substance called radioactive glucose or FDG, and 1 hour later it will go and localize in the primary tumor anywhere it has spread in the body, and the whole body scan is done, and we have the accurate diagnosis staging.
Cyclotron, a machine that accelerates charged particle to higher energies, developed in 1930s to investigate the nucleus of atoms, was introduced into medical sciences to target minutest cell parts. Cyclotrons are used in medical applications such as the production of radioisotopes or radiopharmaceuticals for PET or single photon emission computed tomography. Treatments can be varied in nature and application. Adaptive radiotherapy is a process where treatment is adapted according to changes in the cancerous tumor. It claims to reduce the damage caused to the healthy tissue by providing controlled and calculated radiation according to the needs of the patient.
This unit is called Ethos. It's a very advanced form of radiation oncology unit. The uniqueness about this is that it is adaptive radiotherapy.
Conventional therapies remove the cancer tissue by radiation, chemotherapy or surgery. This process can affect the surrounding healthy tissue. Precision medicine, a futuristic cancer care approach, is introducing technologies like CyberKnife that has significantly improved the treatment outcome of human diseases, especially in cancer therapy. The blend of precision medicine and technologies like CyberKnife are aiming to bring changes for improvement of cancer management. CyberKnife claims to have improved cancer management. Its use has reportedly eased surgical procedures and lowered complications. The procedures are performed on outpatient basis, which can last up to 90 minutes or less.
CyberKnife is probably one of the great inventions for specific radiation oncology, patient-centric. This is a robotic treatment where it precisely looks at the tumor using literally like artificial intelligence.
The modern technological concepts like particle accelerator and X-ray computation have enabled an integrated cancer care approach called Tomotherapy. This therapy blends imaging and radiation therapy, which work hand in glove to provide an image-guided radiation for effectiveness.
Earlier period of time when we were giving radiation therapy, there were limitations so that you can treat a particular area. With the tomotherapy, it is treated in a slice by slice manner and it can be treated with a wider range because we can see the normal structures, normal tissues very well. So the normal tissues can be saved to a larger extent.
In cancers like prostate, lung and liver, the approach of treatment becomes more challenging because of their location and complexities. The emergence of robotics as a technology and its use in medical sciences have made invasive robot-guided surgeries a possibility.
Docking complete. Ready to proceed.
Robotic surgery, also called robot-assisted surgery, allows doctors to perform many types of complex procedures with more precision, flexibility and control.
Instrument number 2 and instrument number 1 is a carrier forceps. So this is the cancer of the terminal.
One of the major advancement because of the evolution of robotic surgery, with the help of robots, we don't have to open up the chest and abdomen, and that is how the recovery of the patient has improved.
HoloLens, a virtual reality-based device helps us to extend our reality beyond the restrictions of physical environment.
Sana, this is a 32-year-old patient. So the patient's CT scan, so the patient is right in front of me here. Probably had a sharp tooth and he's been having this non-healing looking lesion for the last couple of months.
This is a case of a cancer of the tongue patient in which the surgeon is using the HoloLens to get additional inputs from the CT scan, which is giving him all the 3D reconstructed view. We are able to create the virtual 3D prints, and that virtual 3D print superimposed on the patient gives you a much more realistic, better perspective of your planning of tumor margin, about how you're going to clear the tumor more effectively.
मसाज कर रहे हैं अच्छे से, खाना अच्छे से खा पा रहे हैं आप? कुछ तकलीफ है? No.
Technologies enables doctors access to groundbreaking information about nature of cancer. This allows them to gather the data for disease analysis. The use of artificial intelligence, which is effective in computing the data and using it in cancer management, is effectively changing the face of diagnostics and development of cancer management tools and strategies.
Data in today's era will have a pivotal role to improve patient outcomes, because I think it is this data that is going to define prevention. It is this data that is going to define diagnostics, early diagnostics. It is this data that is going to help us in precision oncology and precision medicine.
From data collection, what has emerged is the possibility of use of artificial intelligence in cancer management.
Artificial intelligence is going to give us such good reports. Using that, we can curate properly, understand the disease, and plan for future treatments in a way whereby hopefully we can get first time itself, we can get good remission and long-term control.
Dr. Mithwa Ghosh specializes in clinical genomics. Here, she is examining samples of a patient's blood to identify genetic alterations that may be responsible for cancer.
We try to find out what are the genetic alterations or what are the faulty genes which has actually caused the disease or which is actually not enabling the patient to respond to the therapy. Then, based on the genetic alterations or the genetic abnormalities that the patient has, we treat the patients according to that.
Genomics has broken new grounds in the detection of cancer. Liquid biopsy, a genomic-based method that determines the state of cancer, both active and dormant, through blood and tissue samples.
When we use the word liquid biopsy, it means how do you take a blood sample and make a diagnosis of cancer and also do complete testing. Not only that, but also say if the cancer is still there or not. Using blood sample, we can decide on the circulating tumor cells, the DNA content of the tumor cells. Based on this, detect the cancer in a very early stage.
The challenge is to make these new technologies accessible to a wide range of people, especially in low-income group.
So in future, we believe patients don't have to come to hospital frequently for even follow-up as we go forward, and also mixed reality where actual specialists will be going and talking to the patients at their own home. We can conduct interviews, tumor boards, literally virtually at their own home. That is how we will achieve the goals.
New technological advances have opened up many possibilities in the medical sciences. Artificial intelligence, robotics, and genomics are being integrated into cancer care. The integration of these technologies have the potential to change how we view cancer and shape the future of cancer care. HCG strives to bring these technologies to the doorstep of patients and play an important role in the war against cancer in India.